Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. As the country battles the coronavirus pandemic, NCDC DG asks Nigerian youth to follow non-pharmaceutical measures while exercising their civil rights. Niger State begins COVID-19 sample collection from 15 local government areas which have confirmed cases of the virus. And Spain's northeastern region of Catalonia closes bars and restaurants for 15 days as the country tries to slow the spread of COVID-19. As schools resume nationwide, the Nigerian Center for Disease Control (NCDC) is asking states to conduct risk assessment to mitigate the exposure level of the virus to pupils. According to the NCDC, hand washing with soap and running water is vital to reducing the spread of COVID-19, as well as the use of alcohol-based hand sanitizers where hand washing facilities are unavailable. A look at the figures from the Nigerian Center for Disease Control gives you an idea of where we are right now in terms of the numbers. Now, the NCDC confirmed 225 new cases of the virus in 10 states, and the FCT bringing the total confirmed coronavirus infections across the country to 60,655. We still have Lagos, the FCT, and Oyo states managing over 700 cases, and Lagos has over 4,000 on admission. One death was recorded as a result of COVID-19 complications in the last 24 hours, leaving the fatality toll at 1,116. The number of recoveries have moved up to 52,006 patients. Well, yesterday, the Deputy Incident Commander from the NCDC said 600 local government areas of the 774 have recorded at least one COVID-19 case, and 72% of cases are still due to unknown exposure, while it has expanded testing to over 70 labs with capacity to test about 10,000 samples a day. It says we must remember to abide by the non-pharmaceutical protocols. And while protests continue across Nigeria with youths demanding an end to police brutality in the country, the Nigerian Center for Disease Control Director General has been speaking on the dangers of the virus, mass gatherings and risk assessment. According to Dr. Chikwe Hekwazu, he says the virus does not recognize rich or poor. He says if you are a police officer or a protester, he says just as we've adapted our officers for COVID-19, he says peaceful protests, even in this difficult time, can be done safely so we don't lose our lives agitating for something important. He also says efforts are ongoing with states, partners, also parents to reopen schools safely for the children. He was a guest in our breakfast program, Sunrise Daily.
We saw from experience in other countries that had riots over the last few months what happened subsequently. There was a price that was paid. Weeks later, we saw cases increasing in those countries after weeks of riots around social justice in many parts of the world. We want to prevent that situation here while not taking away anything from the peaceful discussions, peaceful requests being made. So we have to find that balance. How do we get our message out there through the various voices, opportunities that we have, while still preventing a second wave of infections or an escalation of cases in Nigeria? So we continue to advise, even in these difficult times, you would see some of the protesters, only sadly just a small proportion actually are trying. A few people are wearing masks. Especially in the early days, wearing masks, trying to keep some level of distance between each other. So all we're saying is this: we can find a way, just like we've adapted our religious activities for COVID, we've adapted our workspaces for COVID, we've adapted sports for COVID. We also need to adapt our demonstrations for an era of COVID and make sure we do so safely, so that we don't lose our lives in agitating for something that means so much to us. So my appeal is not to forget the very simple but critically important public health measures that we need to take, and we can take. It will not take away anything from our voices if we wear a mask and keep a little bit of a distance, 1 to 2 meters separate from each other, while still making our voices heard as we have been.
Joining us for more on flattening the coronavirus curve is Hafsat Abdullahi. She's a clinical pharmacist with the Maitama District Hospital, also the publicity secretary of the Pharmaceutical Association, Abuja branch. Thank you for joining us on the program.
Thank you.
All right, first, let's get your thoughts on the demonstrations nationwide and, you know, with regards to the adherence to the COVID-19 protocols. Now, on your way to the studio, what did you notice? And do you think that perhaps it takes us back from the gains we've recorded in terms of our response to the COVID-19 pandemic?
Regarding the NSAS protests going on around the country, you notice that most of the protesters, they are not wearing masks, no social distance. Some of them are holding each other. A lot of COVID-19 protocols are being breached at the protests. So therefore, I want to call on the organizers of the protests to call on the protesters to follow the protocols so that their safety is guaranteed. That's what I want to say about the protesters. They should call on the organizers of the protests. They should call on their protesters to please call on them that they should follow the protocols of the COVID-19 so that the spread of the virus can be curbed. Because with what is happening with the mass gathering, there is high risk of spread of the virus. So thank you very much.
All right, indeed. There's also been, a lot of call for perhaps adaptations to the new normal, and a lot of people need to indeed put on their face masks, wash their hands, and indeed follow the non-pharmaceutical protocols. Let's go over to talking about tradomedicine, and this is the COVID-19 traditional medicine research, which is important in the fight against the disease. Now, this week, we understand that Regional Expert Committee on Traditional Medicine for COVID-19 are meeting with experts, researchers across Africa. And this is, with regards to medicine for COVID-19. But tell us, is there anything to suggest that tradomedicine can indeed work against COVID-19? Or are we just looking at immune boosters from traditional medicine?
I think it's a very good development there, the meetings that are going on. Because when you look at traditional medicines, there's a lot of claims already before on ground about traditional medicines that have antiviral properties. So if these researchers researching into traditional medicine are being encouraged and supported so that they go into the research fully, I think it will go a long way in getting a cure for COVID-19. Because when you look at our herbal medicines, especially in Nigeria and Africa, we have a lot of herbal medicines that have good properties against antiviruses. So with this, I think these meetings that are going on is a very good development to help the researchers, and it will boost their morale to go ahead and continue.
All right, so lots of optimism there. Well, I appreciate your time. Thank you so much, Madam Hafsat Abdullahi, clinical pharmacist with the Maitama District Hospital. Thank you for joining us on the program. Let's go over to Niger State, where the government has commenced collection of test samples, and this is from 15 local government areas where cases of the virus have been recorded. Let's get more updates from our correspondent, Emperor Simon.
The report available to us from the State Emergency Operations Center here in Mina shows that Niger State currently has a total of 262 confirmed positive cases of COVID-19, and the death toll still stands at 12. The state government has, however, rolled out mechanism for collection of samples, particularly in the local government areas where cases of COVID-19 have been recorded. The good news is that the state no longer has to wait on NCDC to screen some of these samples, because it currently has its own molecular laboratory where samples are taken to and they are being tested. We also know that schools have resumed, and the State Ministry of Education is not resting on its oars in ensuring safety in the schools. It has commenced distribution of safety equipment to principals from various schools across the state.
I would like to use this opportunity to thank the state government through the commissioner for the assistance given to us to make sure that the issue of COVID-19 is properly taken care of, not only in local government, even in the state as a whole.
This effort from the state government, I think the sky is not just the limit, and I believe this is just the beginning.
But there are still challenges in ensuring compliance among the students, where we see students gather in cluster and not respecting or regarding the protocol of physical distancing. So the state government and the school authority have a role to play in drumming into the ears of the students the need for them to abide by the safety protocols. That's the update from Niger State. Emperor Simon for COVID-19 updates.
Thank you, Simon. Now, almost 1 million people living with HIV/AIDS are at the risk of dying in sub-Saharan Africa following the interruption of their HIV treatment due to the forced national lockdown caused by the pandemic. At the presentation of the HIV quarterly fact sheet, the Director General of the National Agency for the Control of AIDS revealed that the antiretroviral therapy dropped by 45.4% in April 2020.
Nigeria is desperately trying to control the spread of the COVID-19 pandemic, but that is taking its toll on the efforts to curtail the spread of the HIV and AIDS. Nearly 300 confirmed cases are reported daily in this hospital alone, mostly women, snowballing into an average of 1.8 million Nigerians currently living with the virus, according to a 2018 survey by the National Agency for the Control of AIDS. In recent years, the agency might not have achieved phenomenal progress in controlling person-to-person transmission or the provision of antiretroviral drugs, but it boasts of growing infrastructure that has become very useful for increased testing for COVID-19.
I'm yet to get information about the staff that are involved within the agency. All I know is that there has been some resistance of recent, and we have seen some publications and we have received some petitions. But internally, we are looking inward to see, if we have leakage, where are those leakages taking place and how can we prevent that leakage?
In line with efforts to achieve the twin issues of control and sustainability, NACA reveals plans to set a trust fund in order to boost supply of drugs, as well as tackle complicity among staff in the alleged antiretroviral drug fraud.
The machines that are used to test for this virus are the same. The only thing is the reagent that differs. What we did was during the day we test for HIV, at night we test for COVID. And where this infrastructure is not available at the time the COVID hit, Nigeria wouldn't have had the opportunity to hit the ground running.
In spite of a $6.2 billion investment between 2005 and 2018, much of it from foreign donors, the agency is ambitiously aiming for 75 billion naira annually to empower the agency in the treatment of at least 1.5 million Nigerians for life. Gloria Umezuke, Channels Television News.
We have more on the COVID-19 pandemic update when we return. Please stay with us. Welcome back. In Yobe State, academic activities have commenced at the Federal Government Girls College, Potoskum, where the Government College Buniyadi displays by Boko Haram insurgents now occupy. The NCDC safety protocols were strictly observed at the school's gate, and students were glad to be back at school.
Schools across Nigeria were shut for 6 months as a result of the COVID-19 pandemic. It's now a cheery moment for secondary school students as the federal government gives the green light for the reopening of unity schools. At Federal Government Girls College, Potoskum, Yobe State, all NCDC protocols such as temperature checks, hand washing and use of sanitizers are strictly observed. For the students, it's a huge relief to be back in school.
Well, it was bored to stay at home seriously because there was nothing to do. We're just at home for almost like 6 months. Well, we are really happy because we believe that since school have resumed, our education will continue.
The school authorities give a reassurance that all necessary requirements for the children's safety have been put in place.
Long before now, we have been anticipating their coming. And before now, most of us, including our teachers, we have been rubbing minds to get ourselves prepared to welcome our students. And thank God, close to 80% of our students are back. We are fully prepared.
The Federal Government College, Buniyadi, which was attacked by Boko Haram insurgents even before the pandemic, has come alive once again, preparing to receive its students who have been temporarily relocated to FGGC Potoskum to avoid a setback in their studies.
Lovely. Now, space scientists in Nigeria are pushing for the adoption of satellite technology, and this is to predict and also monitor future disease outbreaks in the country. We have joining us from our Abuja studios, Mr. Benjamin Ayotunji. He's the Acting Director, Policy Planning and Research with the National Space Research Development Agency. Thank you for joining us on the program.
Thank you.
So we've heard that satellite technology can actually predict and, of course, monitor health emergencies. How does this work?
Thank you very much. Satellite is like an eye in the sky. Now I'm talking about an Earth-observing satellite. So it's like having an eye placed there in the sky and it's looking down on everything. And knowing fully well that the Earth, the space there, that's the sky, is like a platform. So it gives you an opportunity to see everything better. Now, back to your question on how satellite monitors spread of disease, be it COVID or whatever disease you know. What we do when we use satellite to monitor disease is to monitor the vectors that carries the disease. For example, if you want to monitor malaria, for example, you want to study where you likely have the outbreak of malaria, then you look for likely places where you're going to have mosquitoes. And what makes mosquito is where you have stagnant water. So satellites help you to monitor where you have stagnant waters. And by the time you know places where you have stagnant waters, you'll be able to say, okay, this place you have mosquitoes, and if you have mosquito being the vector for malaria, you're going to have malaria there. Now, concerning COVID, for example, the vector that leads to the spread of COVID is human, is the movement of human being. So, satellite, a high-resolution satellite image can help you to monitor the movement of human being, help you to monitor if there is mass gathering, help you to monitor if people keep social distancing. Now, when all this is put together into a model to predict disease, then you can use the outcome, the result you get from the model to be able to predict that, okay, if satellite sees such a thing in a place, then that place is likely to have outbreak of the disease. That's how satellite, you can use satellite to monitor disease. And this can be done in real time. It is faster because you are looking at it immediately as it's happening, so you can quickly predict that this is going to happen even before it happens.
So as at today, how much of that is NASDRA working on to indeed track, trace the coronavirus with regards to Nigeria's population?
NASDA, in conjunction with Jason Sizer Joe Special Society of Nigeria, developed a mapping platform where you can go and see daily the number of diseases, the number of fatalities, the number of recovery as it happens daily. Now, we use data from NCDC to feed into this hour because NCDC are the one that know the number of people that are affected. But we have the satellite image that shows different locations. So we feed the data from NCDC into our data, and you can go on that platform and see at any point in time how many people are infected in social place in Nigeria, how many people have recovered, and how many people have died. So that's what we are doing for now. We also believe that we can do more, which we are trying to do now. We can do more to begin to, instead of telling you what is happening, to begin to predict using that same platform where we expect, as a sort of projection, where we expect this to happen next. So that's what the agency is doing for now.
So finally, with regards to the future of, tracking health emergencies in Nigeria, you think that this technology and several others would indeed go a long way? Because I also know that the NASDRA is also working on fast-tracking telemedicine as well.
Yes, this technology will be very, very useful because it gives you the opportunity to do real-time prediction. Now, the telemedicine project, which NASDA is doing, the telemedicine uses the communication aspect of the satellite, and it enables you to be able to reach location where it might not be possible to have a tertiary or an up-to-date healthcare facility, which means that people in rural area can be attended to by doctors in tertiary institution through the telemedicine project. Also, the telemedicine, because it is mobile, it's like a mobile hospital. It carries all the facilities you need, can be deployed to do testing about immediately. It can also be used to maybe moving infected individuals to isolation center because you have all the facilities you need on the telemedicine. And through satellite, you can communicate with a doctor wherever a doctor is, anywhere across the world in real time to be able to take care of this. So the telemedicine project, which NASA is doing, is also very, very important. The agency, at the heat of the lockdown, the agency launched the telemedicine bus, and currently we are working on having it almost everywhere in the country. Thank you.
All right, thank you so much. We appreciate your time. We continue to follow the developments. Mr. Benjamin Ayotunji, the Acting Director, Policy Planning and Research with NASDRA, thank you for joining us.
Thank you so much.
Now, Spain's northeastern region of Catalonia has said bars and restaurants are to close for 15 days from Thursday as the country tries to slow the spread of the coronavirus. Across Europe, governments are introducing new restrictions to battle a second wave of infections. The Czech Republic has shut schools and bars, Dutch cafes and restaurants are closing, and France may impose curfews. In the Netherlands, a partial lockdown comes into force at 2000 GMT. And although there's evidence that younger people are at low risk to COVID-19, remember that low risk doesn't mean no risk. Continue to take responsibility. We have more updates on the pandemic. You can take a look at our website. It's channelstv.com. There's several other stories, the trending issues across Nigeria, Africa, and the rest of the world. That's the program this evening. Thank you for watching. I'm Millicent Nwaka. Stay safe.